Hello viewers, this is Dr. Iftikhar Aslam from Pakistan. Today I'm going to present a lecture on Campylobacteriosis, which is also known as Campylobacter enteritis, Vibrionic enteritis or vibriosis. In today's lecture, we'll cover the information regarding the organism that causes Campylobacteriosis and its epidemiology. We will also talk about the history of the disease, how it is transmitted, species that it affects, including humans, and the clinical and necropsy signs observed. Finally, we will address the prevention and control measures as well as the actions to take if the Campylobacteriosis is suspected. Campylobacter are gram-negative, microaerophilic, curved or spiral rows in the family Campylobacteriaceae. Campylobacter jejuni, which is formerly known as Campylobacter fetus subspecies jejuni, and Campylobacter coli are associated with enteritis in domestic animals and humans. Some strains of Campylobacter jejuni, Campylobacter fetus subspecies venerealis, and Campylobacter fetus subspecies fetus, which is also known as Campylobacter fetus subspecies intestinalis and Vibrio fetus var intestinalis, cause infertility and abortions in sheep and cattle. Campylobacter fetus subspecies fetus is occasionally isolated from the humans with the septicemia. Other species of Campylobacter, including Campylobacter lerai, Campylobacter hyointestinalis, and Campylobacter upsilonensis, can cause disease but seem to be of minor importance in domestic animals. Uncharacterized Campylobacter species may be involved in proliferative ileitis of hamsters, porcine proliferative enteritis, and proliferative colitis of ferrets. In 1886, the German scientist Escherich published a series of articles that described a spiral bacteria in the colons of children who had died of what he called cholera infantum. This work, however, went largely unrecognized until 1980s. Although the Campylobacter species were associated with the human infections throughout the 1940s and 50s, it wasn't until the 1970s that they were fully recognized as human pathogens. A crucial step in this process was the isolation of Campylobacter from human feces in 1968. During the mid 1900s, the Campylobacter species were also isolated from the animals that experienced abortion and sterility. Campylobacter jejuni, Campylobacter coli, and Campylobacter fetus infections are found worldwide. Campylobacter jejuni is one of the most common causes of bacterial diarrhea in the United States. Roughly 20 cases per 100,000 population are seen yearly. Worldwide, Campylobacteriosis is responsible for approximately 5 to 14% of all the cases of diarrhea. Infections are particularly common in very young children in developing countries and in children and the young adults in developed countries. Most cases are sporadic, but outbreaks associated with the sources such as raw milk are also seen. Campylobacter jejuni and Campylobacter coli can infect animals such as cattle, sheep, chickens, turkeys, dogs, cats, mink, ferrets, pigs, non-human primates, and other species. Campylobacter fetus subspecies fetus is found in cattle, sheep, and goats. Campylobacter fetus subspecies venerealis is found in cattle. Animals can be infected asymptomatically with any of these organisms. Campylobacter jejuni and occasionally Campylobacter coli can cause enteritis in dogs, cats, cows, sheep, mink, ferrets, poultry, and some species of laboratory animals. Enteritis is more common in young animals, but stress or concurrent disease increase the risk of the disease in adults. In dogs, the symptoms can include diarrhea, decreased appetite, vomiting, and sometimes fever. The feces are usually watery or bile streaked with mucus and sometimes blood. The symptoms generally last 3 to 7 days, but some animals may have intermittent diarrhea of weeks and occasionally for months. The calves typically have a thick mucoid diarrhea with occasional flecks of the blood. Mucoid, watery, and sometimes bloody diarrhea is also seen in cats, primates, mink, and ferrets. Newly hatched chicks and poultry develop acute enteritis with rapid onset of diarrhea and death. Other species of the Campylobacter, including Campylobacter lerai, Campylobacter hyointestinalis, can cause disease but seem to be of minor importance. Uncharacterized Campylobacter species may be involved in proliferative ileitis of hamster, porcine proliferative enteritis, and proliferative colitis of ferrets. Campylobacter has also been implicated in avian hepatitis, and this association is still unproven. Enteritis can be diagnosed by isolating the causative organism in fresh fecal samples. However, Campylobacter is fragile and cannot always be found. In unfavorable environments such as low pH or prolonged low temperatures, a presumptive diagnosis can also be made by observing the characteristic darting motility in the dark field or phase contrast preparations. Gram-negative curved or spiral rods are seen in gram-stained preparations. A polymerase chain reaction PCR-based assay is used to screen the poultry broilers in Denmark, and a commercial PCR-based assay is available for meat samples. Antigen capture enzyme linked immunosorbent assay have been described in literature. Serology on paired titers may be helpful in some cases. Antibiotics may be useful for some cases of enteritis. However, the information on efficacy is limited. Antibiotics may also prevent exposed sheep from aborting during an outbreak. Bulls with bovine genital campylobacteriosis are sometimes treated. Cows usually are not, due to the practical consideration. Vaccines are not available for enteritis but can prevent abortions in sheep. They are also useful for both prophylaxis and treatment in bovine genital campylobacteriosis. However, the vaccinated cows may remain carriers. Artificial insemination can control or prevent the bovine genital campylobacteriosis. Sanitation and management can help prevent the infections in poultry. Rodents and wild birds should be excluded from the poultry facilities, and insect populations should be controlled. Chlorination of drinking water can help prevent waterborne infections. All in, all out management with decontamination of housing between the flocks can also decrease the risk of infection, as can the maintenance of a closed flock. Preventive measures in sheep include hygiene and sanitation to prevent fecal contamination of feed or drinking water, as well as the management techniques to avoid mixing potentially infected and susceptible pregnant animals. Good hygiene and disinfection should be used to prevent spreading Campylobacter on fomites or abortion products during an outbreak. Well, with this, we are going to end our today's lecture. Thank you for watching this video.